The professor's formulas then vary. Important information is information about the manufacturer. And the pharmaceutical company is called Farmacia Metallo. It is located in Milan. Accordingly, this guarantees quality, and further, there is some more important information. And the safety of the preparation formula, quality control. And of course, all this guarantees, we understand, an excellent clinical response. All this is guaranteed by my scientific group, which is fully engaged in production control, called FMET Commerce. The names of the products will be the same ones that many of you already know, which are those registered internationally for my formulations. Only the one dedicated to optimizing the condition of the hair that it had a name created by Alcevice which was meaningless, as we will see later. And so we gave the name Trix Optimized to give the right product name index. Product names will remain basically the same, because they are already registered in our country. We change to He knows me, he knows that. I represent physiological medicine and not. We are therefore interested in providing an aesthetic improvement of our patient through corrections, then using some adjustments to the existing state, but we use such products which help restore the natural level. Youth. So following the physiology of our body, when we have a small damage our tissues regenerate. That is, the tissue reforms in the whereas when we don't have it we have a very important damage. We have a volumetric character repair with the formation of foreign tissue, so obviously we want dare a speech of regeneration, and let's see what happens when there is a small damage. The cell breaks and all the substances inside come out. A compound produces the reactive inflammation we have when pain. DNA binds to interleukin 26 and form an inflammasome and activate the process of reactive inflammation caused by biological damage here. Let's see the presentation now. Ah well, you don't see, so I have to put it back. The presentation, I don't know what happened, but let's see immediately. Let's move on. Here we are now, you see it, yes, 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 and perfect. So he already translated this thing accordingly. We have the formation of this reactive inflammation with production of its purpose is precisely to activate differentiation stem cells for the regeneration of aging tissue. Today we have completely changed the product, as we can see now from the formula that we will explain. Formula based on new data. In order to carry out the correct work with free radicals, the literature tells us precisely that these small quantities of free radicals that determine the differentiation of stem cells. But it also tells us that this concentration must be very small. Exact ed. Scientific literature says it is important to use precise concentration because the effect of the drug on free radicals depends on the concentration. And accordingly, if we want to activate the differentiation of proliferating stem cells, then we must produce exactly the right amount. And we have to use this exact concentration because the concentrations this is because free radicals today are cellular mediators, and therefore if I use the correct concentration for stem cell differentiation, if I use a lower concentration I get no response. But if I use a higher concentration, I have apoptotic cell death. So instead of giving a regeneration, I'm going to give a damage. And you can actually see on the slide what exactly it happens again. If we use a reduced concentration, Otherwise, the differentiation of stem cells decreases. Higher concentrations require a regeneration treatment. They are subjects who already have inside their skin has an inflammatory state. This is because they are advanced in age. Both because sun exposure determines the activation of inflammaging. What does this lead to then introducing other free radicals? In addition to those already inside, causes biological damage to the skin. In a situation where we are dealing with patients of advanced age. They already have some inflammation in their skin. And that is, they are already subject to aging, there may be photoaging and so on. This is a common situation in advanced age patients. And if we enter a certain amount, additional free radicals such skin, then their skin is already. We saw that when a cell breaks and nucleic acids come out. These then come metabolized by enzymes present outside of the cell itself and are transformed first. Nucleoside. We studied a new pathway for activating proliferating stem cells and we said that when damaged, a rupture occurs. Cells and the release of nucleic acids from its interior. That this process is blocked by the binding of histones to methyl groups. This kind of closure occurs because the genes are bound to proteins called histones. And to read this gene, the histone must open. Adenosine causes activation of histone demethylase, an enzyme capable of breaking the methyl bond and opening genes. of lactate, and then glucose is used to form this lactate. Adding some lactate allows us to allow glucose to form ATP and help the cell differentiate. This is because cellular energy in the form of ATP is produced from glucose by its complete metabolism, and accordingly we add lactate. However, the stem cell that is attached to has a reduced lactate concentration, and glucose is used to compensate for this deficiency. Glucose prevents the formation of ATF, that is, energy, and, accordingly, differentiation, that is, division. Finally, we also add nicotinamide to these two products, which enhances and regulates stem cell differentiation and the beta transformofactor. So finally we add another substance which regulates the division process. It is nicotinamide, which through deacetylation of sirtuins regulates the activation of stem cells and also transforming growth factor, beta 1. Directly from the platelets. However, a very careful preparation of the blood is necessary for getting the right amount of growth factors, and so recently it has been we have growth factors, namely transform microfactor beta, IGF-1 and GABA. In addition to the fragments of hyaluronic acid, and very important difference in this new one is the right concentration of growth factors. Contains a set amount of biomimetic growth factors as well as a correct. And this is a more correct product, since it differs from the old recipe accordingly. And we, as in the old formula, added a gamic neurotransmitter, but in this case we use the correct concentration. And also there is one more important component. We use hyaluronic acid fragments in this product, and selected with the parameter see then the importance of this variation. We said that inside there are medical biome growth factors. The first difference is that today we have a concentration exact which allows us to have the right clinical response. And this is because growth factors have the so-called paradoxical effect. That is, if they have the right concentration, they give me the answer I want. If I increase my concentration, I don't improve my response but make it worse. So, let's pay attention to the first most important difference. In fact, the studies that were carried out not so long ago, they showed that growth factors, in particular one Djiboutian Frank, they have a paradoxical effect, that is, it means, which is exactly what we need to use to achieve clinical results. Neuronic, here we see that literature tells us that the fragments included between 7 and 14 Daltons give us the stimulation of the receptors of fibroblast to determine a biological stimulation as they are. Once these fragments are made, macromolecular hyaluronic acid is obtained, and it is fragmented, then this fraction is taken, but it is very important that this fraction, and then an even more important point is the use of hyaluronic acid. But again here we are turning to the existing scientific literature of the new. And we came to the conclusion that it is necessary to use the correct fragmentation. That is, even if it was present in the old formula. Acid in the range from 7 to 14 kDa. And we checked the sizes of hyaluronic acid fragments. Because hyaluronic acid is subject to fragmentation and these fragments are already being used, they are obtained by lateral processing of large molecules. And we used the size 7 kDa. And this allows us to avoid the risk of inflammation, and since indeed fragments of hyaluronic acid in a larger range, let's say 15 more, sometimes they cause activation of a macrophage. And the answer so it is very important that we move towards the fragments. Low concentration. The important conclusion is that we need to move to using fragments with low concentration. Because fragments with high concentrations lead to exactly the wrong result. To a harmful result. If we already go up to 15 Dalton, we no longer have fibroblast stimulation. But we have macrophage stimulation. Macrophage is a defense cell of our organism that, however, it can activate and become inflammatory. So if I introduce growth factors inside, where there are some fragments of hyaluronic acid where inside there is some fraction that exceeds the value of 14. I cause inflammation and damage to the skin level. That's why today we ask for a concentration of 7 kD. ITAK, we understand that if we use a higher concentration, starting from 15 kDa, then accordingly we get a different reaction. We have a macrophage that is activated. A macrophage is a protective function of the body. But in a certain situation, the macrophage leads to inflammation. That is, we actually get absolutely unnecessary inflammation. And if we take a lower concentration, Simca, yes, then we can avoid the risk of this inflammation, accordingly. At this stage we already need to stimulate regeneration of adipose tissue. And accordingly, we need to normalize facial volumes lost with age, respectively. Next stage, matrice. Extracellular. For a long time it was thought that it was something that only supported differentiated tissues. Instead, it has very important functions. Collects growth factors inside and then presents them. When are these needed? At the cell receptor level. So here we also have a formula which allows you to return lost fatty elements. Sections, parts where the fat pad has been lost, return them to their original volume. And to achieve this result, we use precisely the physiology of adipose tissue. And since it is subject to age-related changes, it also has a mechanical action on the cytoskeleton of the cell called mechanotransduction, which leads both to the expressiveness of cellular receptors, both to the opening of the nuclear pools to allow protein synthesis, both to the differentiation of cells in such a way we carry out a special approach to achieving this result. We use the physiology of adipose tissue, which changes its cellularity depending on energy needs. And since it stimulates adipocyte hypertrophy, differentiation of stem cells with the formation of new adipocytes, and accordingly, our intervention requires an incentive to the formation of new reeds. The optimized skin that contains both inside the precursors of the matrix forming components. See a product. which is called Skin Optimize, and this product allows. We should contact you specifically. Of glucosamine, which previously had not been added due to cosmetic technique problems, which allows us to correctly build the hyaluronic acid that we have seen. A blockade of inflammatory damage. Inside there was already some ascorbic acid to prevent oxidative damage. But the inflammatory damage remained. Action, thus improving the anti-aging effect of the formula. We actually already had ascorbic acid in our previous product. It acts against oxidative damage, but with adenylyl methodenite it is formed. So Skin Optimize also has a new, more complete formula, which gives me the certainty of the clinical response, makes me a prevention and reduction of damage to the skin. As we can see, Skin Optimized also has an improved formula compared to the old drug. It contains major changes, which allow us to obtain a more complete clinical answer, respectively. namely on functional restoration, physiological restoration of the skin, bringing it into the appropriate state, and not just reducing the visible effect. Literature tells us that the greater the concentration of type 3 collagen is younger a skin. The higher the concentration of type 1 collagen, the older the skin is. So I have young fibroblasts that produce collagen for me. Of the third type, they really make my patient's skin rejuvenate. And now the scientific literature tells us exactly what. Type 3 collagen leads to rejuvenation. Accordingly, this is what is very important. Due to the formation of collagen type 3, we can provide the skin with biomimetic PRP. This will lead to an increase in quantity of these young fibroblasts to stimulate them to functional production at the skin level. So, we get a protocol such that activation of the immolating cells occurs. We give PP injection after 21 days. And thus we achieve already in the development of cell metabolism. The skin regeneration scheme provides for the use of stamin C at 0 time. After 21 days, when we have the formation of the young fibroblasts, we use biomimetic PRP. After which we insert ourselves once a month with the optimization of the use skin optimize once a month, and in this way we go through the whole cycle, and then this cycle can be repeated in the same order subsequently. We do this cycle twice a year because it has been seen that the reticular collagen that is formed lasts about 8 months. And so twice a year we reactivate the entire regeneration process. And thus we can apply this protocol twice a year. Accordingly, the skin will go through a full recovery cycle during this period. Skin generation is not enough to improve the aesthetics of a face. This is because the thickness of the skin is 3 millimeters, while the underlying adipose tissue decreases when it does. Determines this decrease in volume which by gravity causes all the unsightly situations ranging from creases to wrinkles, to relaxations, and therefore we must think about regenerating the skin also. So, but all this, nevertheless, is not quite enough for that. To bring back, that same look, which we want to give to our patient's face. The thing is that the skin is thin, its thickness is about 3 millimeters. We need to address the lipid part. To do this, we use a treatment called lipogenetic, which, as we can see, it can normalize all my fat compartments of the face and restore the aesthetic appearance that we want. To do this, we use the increase of the volume of the adipocyte that reaches a certain size. It stimulates my stem cells to then form new adipocytes. It is now that we are moving on to this most important stage. We use a drug here, which is aimed on and stimulation of adipose tissue regeneration, which will allow us to again normalize the volumes of the face that were lost with age. But at this stage we use this drug, and thus the adipocyte reaches a volume greater than 170% of its volume normal, and which prevents it from putting other triglycerides inside. Sends a message to the stem cells to go and multiply and to differentiate. So here we understand that in order to achieve this result, we must turn to the physiology of adipose tissue. And adipose tissue changes its cellularity depending on energy needs. And we are talking about adipocyte hypertrophy. It stimulates differentiation and division of stem cells. Cells with the formation of new adipocytes, that is, in this case, a stem. Here we see in the slide that the stimulus for stem cell differentiation occurs when the depot cell reaches a volume 170% greater than the normal volume. To get all this, so we have to increase the concentration of triglycerides inside the adipocyte. So we need to combine some glycerol with some fatty acids to form glucose, and the combination of glycerophosphate with fatty acids. For this reason we used a glucose solution mixed with a few units of insulin for the experiment. The initial clinical study includes, it involved the use of a glucose solution with insulin inside. Insulin in fact allows both the entry of glucose into the cell, so to go and form the glycerophosphate, both the stimulation of the enzyme lipoprotein lipase to take fatty acids and put them inside the adipocyte, and Insulin, because this is a drug and the first lipogenetic product. And in addition to glucose, he used IGF-1, that is, the insulinofactor, which is a mimetic of insulin itself. The new product has completely changed because even though it still uses glucose or insulin added to other formulations needed to achieve the result. Clay pot. All this, of course, allows you to combine with glycerol fatty acids to carry out a new synthesis of triglycerides. But we can't use insulin because it's a medicine, so we But of course it does not have the full function of insulin. Does allow glucose to enter the cell, but does not have this function. Acts on a different receptor than insulin. But inside the cell it has the same action of insulin because it allows the passage of glucose. Then glucose will enter through the ecrofactor with insulin inside the adipocyte cell and will form glycerophosphate. That is, let us again pay attention. We have actions that are very similar. In fact, they repeat the effect of insulin in the cell, and this is the same effect, which allows glucose to pass into the cell, but accordingly. This is not insulin in its classical sense. That is, it is not insulin a medicine, but it is a substance. We must also have the fatty acids to determine the formation of triglycerides, and unfortunately insulin growth factor has no action, the ability to take fatty acids. No, here again another situation, a problem arises. The fact that insulin is a growth factor, it at least allows the passage of glucose. But it does not have this function in relation to fatty acids. But we also need fatty acids, we also need to get them from somewhere. For this reason we added sodium selenate, which, as we see from the literature, that it is capable of activating lipoprotein lipase. Take the fatty acids and put them inside the adipocyte. Which, according to the literature, activates an enzyme called lipoprotein lipase. And it allows the penetration of fatty acids into the adipocyte, which facilitates new formation. Lipogenetic preparation is completely new because it allows me both the correct stimulation in the formation of triglycerides, either a direct activation of stem cells to form, and thus we see that the lipogenetic drug now has a completely new formula. Because now we have the possibility of achieving division of dormant stem cells. present in adipose tissue and obtain the necessary answer. And this process is also quite fast. And here we achieve the passage of glucose into the cell. Accordingly we have. And also the effect of the passage of fatty acids, and accordingly. This preparation includes all these elements. And lipogenetics has the function of stimulating tissue regeneration and normalizing. Volumes of the face there are lost. With age. The recommended solution is to use the fabric once every 15 days. Lipogenetics infiltrated into the patient's fat until where we see the optimization of the result because new adipocytes. They have an average lifespan of 6 to 8 years, and therefore we can talk about an almost permanent. We also have a regeneration protocol here. Tissue, and it includes infiltration of lipogenetic solution. And this happens accordingly once every 15 days. And we see. What is the average life expectancy? New. How many soft tissues, skin and subcutaneous tissue? We also worry about the supporting tissues. And in particular of muscle tissue. Both on the regenerative level and on the toning level for improve. About other fabrics, because we need to work with them too. In this situation we are talking about muscle tissue, and accordingly. This ready product is excellent from the point of view of clinical response. But we also added some phosphocreatine for allow for proper energy formation because the muscle produces. It consumes a lot of ATP, and therefore it is very important to never let it be in shortage. We regenerate the muscles of the face, always starting with activation of stem cells at time 0 and after 21 days with PRP. But a little regeneration is needed because new muscle fiber cells have a lifespan of about 12 years. The regeneration of the facial tissues is finished. Let's move on to a very important skin appendage, that of the hair. The product that was proposed by Ceviche. He had a name invented by Ceviche, which has no meaning because we are talking about growth with mesotherapy. But it doesn't specify what it concerns, and so we changed the name by putting impact on the skin of the face. Now we move on to other areas. Also, no less important is hair regeneration. Accordingly, here we will talk about our new drug, which is just in the title. It is also different. We decided to change the name because the company uses a certain drug, but in general it does not reflect its function in any way. And even the name that the company Rozovic has, it doesn't really make sense. So we decided to give it a completely new name. The drug is called Trix Optimize. Of the act to stimulate stem cells and therefore allow the new training to be reactivated. Hair that has a cycle and therefore after a certain period of time physiologically falls. And the old formula, it already contained lactate for normalization, energy balance of hair follicle stem cells, necessary for the process and new. Cyclades. That is the formation of the cyclic MP and therefore the formation of the energy needed to keep the hair alive. Then the hair regresses and falls out. So what affects the hair that leads to alopecia? In essence, hair loss is associated with a disruption in the energy balance of the hair. And if we see that dihydrotestosterone acts on an enzyme called adenylocycline, and it is necessary for the production of CAMP, otherwise dihydrotestosterone blocks it. And this leads to an energy deficit of hair, SAW, which passes from the anagen phase into monophyline. It is added to the original formula and has a double effect. That is, it activates adenylocyclase and stimulates the formation of CMP. That is, it normalizes the energy balance of the hair. This xanthine base is monophyline. Monophyline has a double action because, first of all, it determines the activation of adenylate cyclase and therefore the new formation of cyclic AMP and the necessary energy of the hair. But at the same time, it makes the action of the cyclic MP last longer because it blocks an enzyme called phosphodiesterase which rapidly destroys this MP cyclic. So finally I have a certain amount of energy. New one that lasts me for a fairly long time and makes me feel more. So since we have added this new element, then accordingly we get the corresponding effect. The enzyme phosphorus deuterase, which destroys, is blocked, destroying the resulting CMF and provides a longer energy supply. The effect is as a result the trophism of the hair improves and its resistance increases to hair loss. We are still concerned about another type of fall in hair which is caused by the contraction of the galeoccipes. The gala occipes is a fibromuscular structure that is present on the head which can be entered into contraction for two reasons. Or because we have stress and therefore, let's release this stress by contracting this gala occipitis. Or for an aesthetic treatment in women. And we also have one more problem, and it is important to remember that the tension in the scalp could be muscle tension from stress. It could be some mechanical effect of cosmetic procedures for hair. All this causes local inclusion through inflammation. An activation of an inflammatory process that the increase in the concentration of dihydrotestosterone stimulates me and makes my hair fall out. For this we use sulfoadenosylmethionine, which we have already talked about how to limit the inflammatory process and necessary for the correct union with adenosine triphosphate allows me to synthesize sulfodienacylmethionine and reduce this inflammatory process. So, and we understand that here we are again talking. And first of all about the correct concentration, that is, this particular point is very important to us. Correct concentration of methionine with ATP. It is she who has that very inhibitory effect. Action on inflammatory genes and weakened hair. They are already becoming stronger and thus this leads to hair restoration and of the product itself, and it is complete because I like it. To act on all the situations that bring me. And we see that this product is literally doubly changed. Because it has a different name, yes, we are completely separating from the previous product. And most importantly, it contains major changes. Who allow us to receive. It involves the deep insertion of the product starting from 0 time. With the activation of stem cells after 21 to 30 days with the So we see that we have a specific protocol for this drug and its use. Accordingly, we apply it to 20. The first day, and we also combine here we have STAM Inc. Then PRPBM. Tissue regeneration. However, the patient can come to us with an existing aesthetic damage situation. So we can have a patient with flaccidity. We can have a patient with some pigmentations or a patient with volumetric excesses. So even in this case we can to act both by restructuring, therefore increasing the consistency of the skin, both whitening the cute we can see that a patient can come to us with different problems. Maybe there is some excess tissue he has. of the correct acid pH of hyperosmolarity, necessary to determine the production of type 1 collagen. At the same time, the accuracy that must be used to go there. To introduce the liquid directly into the dermis to obtain relaxation. And the formula here remains the same for us. Because this product is based on the pH effect. Tone once a week for 4 times. Then a wait of 30 to 40 days to see the contraction, and then repeat the cycle if necessary. Accordingly, here we administer the drug in 4 procedures every week. Then a break is made for a month. And thus the treatment is carried out. As for skin pigmentation, we use skin whitening, which it involves infiltration into the pigmented area of a solution that does not eliminate melanin. At a more or less deep level depending on the depth of the arbutin. And then remember the action, which is that of the transformation of the eomelanin black eomelanin brown and the slowing down of the new. The formation of EH involves surface infiltration of pigmentation throughout the area we use it. Once a week until results are achieved. And accordingly we follow this protocol. Because what we need to pay attention to here is eomelanin. It comes in black form and brown eomelanin. And accordingly we have the effect of a doliquinone. And acids on these 2 melanins. That is what is important here. The very important thing is the angle of the lake that is used depending on of the depth of where the melanin has arrived in the need always to overflow. Pay attention to the fact that according to the protocol we must comply. Choose the correct needle thickness. And to provide exactly what is needed. Penetration and the length of the needle to the required depth, respectively. In the products is the fat apoptosis. This allows me to determine this natural death of excess fat cells, both at the level of the eyelid bags, both at the level of excess folds on the face, both in the submental area. The product must be carefully inserted into the fat in the area that where we want to decrease the number of cells in the dipose and Vosne. moment. Introduction of the drug fatasis, and here we are again. We see that we need to insert the needle correctly. It's 90 degrees as we see it in the slide. And thus we get to the right layer and reduce the effects. The formula is a particular formula that has been registered, will also be produced as a medical device, and where it joins sodium ascorbate together with ferric iron. So also in the new product, this type of formula quality is maintained. The important thing is that the concentration was studied of ascorbic acid necessary to give apoptosis up to arrive at an answer that we have called controlled necrosis is. Developments, although it retains the basic formula, it already demonstrates, of course, a much more significant and much safer clinical outcome. And since here is the main study of this method, it is based on a combination of certain quantities of ascorbic acid with iron solution. This mixture causes two successive reactions. They release a number of oxygen-free radicals and oxygen-free radicals necessary for cell damage. Well, it was clinically important to achieve such damage that causes apoptosis. That is, this is the death of cells without their destruction, but we avoid necrosis. Yes, this is when the death of cells along with their destruction. This is due to the fact that when cells are destroyed, inflammatory substances are released. Severe inflammation can, of course, lead to irreversible biological damage. The biological reaction is based on two different types of reactions. The first is the Aberway's reaction and the second is the Fenton reaction. In this we have the reaction of ferric iron with the acid ascorbic acid, which from the final point of view forms me of bivalent iron that reacts with hydrogen peroxide to form free radicals. Beyond these reactions, it is very important to know that by varying the concentration of ascorbic acid, I can get the exact concentration of free radicals I want. We speak in more detail about a combination of ascorbic acid with iron solution. We are talking about these here. Two consecutive reactions, we can have a reaction or the Fenton reaction. Here they release a number of free oxygen radicals. And we can, with the right concentration, influence these processes. That is, we can influence the result that we get. And it is precisely the right concentration that helps us avoid necrosis. That is, we can avoid those very ones. Resulting in inflammation and tissue damage, which I don't have if I do apoptosis. And accordingly, necrosis consists in the fact that And propydium iodide, I can see if I have apoptosis in the case of positivity to annexin 5 if I have necrosis in case of positivity. D. Propidio careful studies using immunofluorescence with anoxin type 5, which reveals apoptosis with propydium iodide. He reveals necrosis, they just let us cross. The number of cells undergoing apoptosis and the number of cells which we bring into necrosis by varying the concentration of acid. Ascorbico, this is exactly what we are trying to achieve. That is, a quantitative assessment of the number of cells, which can be sent into necrosis without increasing the concentration of inflammatory cytokines. Active forms of oxygen, allowed. A concentration of acid. Ascorbic acid that also gives me a small necrosis, which however where as a result of this necrosis I do not have a production of a inflammatory response such as to be able to and we get controlled necrosis, we get controlled necrosis, which helps us avoid inflammation. Yes, that is, we get necrosis without an increase concentrations of these very inflammatory cytokines. It is they that cause damage, as well as active forms of oxygen. They are responsible for the damage, and we are accordingly was present in the old formulation is the correct identification of the correct pH value that allows me to avoid the formation of hydroxide. Ferric, this is because you might think that adding ascorbic acid together with ferric iron I have the reaction and I have the answer. In reality, this is not, because ferric iron can be transformed into iron hydroxide. And this and another important point is the optimization of the pH level. Basic solutions, and since I was also working hard on this issue, studied the corresponding reactions in. Here I can emphasize the importance of product stability in an acidic environment and preventing the formation of iron hydroxide, which of course greatly reduces the clinical effect. So the new product, while maintaining that qualitative formulation that the one already written on the old product, has the ability to give me a much more important clinical response because it causes necrosis. Controlled gives me the certainty of the clinical response because it does not. I have the block of the action of ferric iron with the transformation of changes. Formula, because now I once again I would like to emphasize the importance of stabilizing the product in an acidic environment. That is, it is very important to prevent the formation of iron hydroxide, because the effect of this formation of iron hydroxide is greatly reduced. That is, these are the most important changes that we have made in exactly that. What we have already listed regarding ascorbic acid. The importance of the correct selection and its concentration, it really. For the face from a volumetric point of view, we have a formulation that it gives me a greater amount of product that can be used on the body. It is very important to always insert a maximum of 1 milliliter per square centimeter on both the face and the body to avoid a change in the concentration of radicals free that we produce. Now we see that this drug can be administered into the body in those areas which require treatment, improvements, and here it is enough to enter literally 1 milliliter. And accordingly to this area. And the needle is at a 90 degrees angle, and accordingly we bring this And also for women, a particularly important point is the restoration of the appearance of the breast. Since, say, a loss of volume may occur due to various situations. Maybe this is some kind of incorrect weight loss and too much. Perhaps also carried out in the wrong way. In this case, we also need to do something about it. Finally, with the recent increase in aesthetic gynecology, the lipogenetic solution can also be used to reduce the opening of the vaginal meatus through the regeneration of the poso tissue. In the big lips, this allows it to maintain a certain softness compared to fillers. And for female genital organs, accordingly introduce it into large sexual cubes and thus the most this new preparation that we have of formulations, innovative with this new line and that you will already find on the market. Through the information which Konstantin and Vladimir will give you, I thank you for the attention you have given me up to now. I would like to thank Anastasia in particular for her skill as a translator, and here you see the scientific site of our scientific group recorded. It is www.femed.org. See my email address. And where even in Russian I can answer thanks to Google Translate. See also a last text in Italian in English that concerns regenerative medicine. Now I would like to leave space for questions and answers that perhaps become more interesting than what I have told you so far. Thank you so much. And so this whole new collection products will be available to you for purchase for work. And I would like to thank you for being here, for the fact that you listened to me so attentively. I thank Anastasia for the translation. And I also present you with all the necessary information on the slide. Here is my website where you can also find all the information. Here is my email where I receive. And I will also be happy to answer them, because Google Translate allows me to answer in any language. And also you see a slide with my brochure. Now I think that with the part that I wanted to tell you, I'm already finished, but I'd like to hear your questions. Perhaps it will be even more interesting than what I have already told you. Yes, I still have the acid fragments. Hyaluronic acid, but we said that the literature tells us about a size range of these fragments ranging from 7 to 14 kilograms raises the problem. Is that when we use hyaluronic acid fragments? We are not if we take that as there is division between large fragments, medium fragments and small fragments. But in these little fragments I don't know if I can go on Anastasia, do you want me to stop every now and then? It is the drug that continues the acid. It is very important to note that it is the concentration that is important. Because concentration, as scientific literature tells us, should be in the range from 7 to 14 kDa. That is, we can divide hyaluronic acid into different fragments, respectively small, medium and large. Small fragments. I can also find fragments that are slightly larger. At 14 K Dalton, and since if I get to 15 I don't have any more. The response of fibroblast stimulation, but I have the activation of an inflammatory process. We ask not to have the range. Small fragments but having a range of 7 K Daltons, which gives me confidence of the fibroblast response without inflammation. Because if we follow the concentration from 7 to 14 kDa, then we risk getting into some increase of this concentration. We move at least to 15 kDa, then we already have a different clinical response. That is, we can get a fibroblast stimulation response. And this leads to inflammation, so here I have already insisted that in the formula there will be exactly 7 kDa. That is, we thus completely guarantee the absence of any inflammation. This kind of reaction cannot happen. Thank you. Thank you so much once again, and I hope we see each other in Rome. Very very willingly I will be happy to. I'm glad you found some new things, because these are actually some new products, therefore they're completely different products from those that are products by Alcevice, but above all being products new and checked by me personally.